Hi everyone, I'm Stella, and today I will be presenting the issue of injecting drug use in inner city slums. So, inner city slums can be defined as socio-economically disadvantaged communities that are situated within central and urban environments. These populations often experience poor health outcomes, high rates of crime, increased availability to drugs and drug exposure, inadequate access to basic services and healthcare. And although this has been predominantly phased out of Australia, there are still parts in major cities such as Sydney and Melbourne that still reflect these environments. People who inject drugs have been classified as a vulnerable and marginalised group within society as they face various social and health related harms. Within the Australian context, heroin has been recognised as the most common drug use, accounting for 46%, where methamphetamine has been accounted for 41%. The Australian Institute of Health and Welfare have identified population groups due to their vulnerability, the first one being Aboriginal and Torres Strait Islanders that have been recognised as a population group due to being disproportionately represented. High rates of usage can be linked to the ongoing effects of colonisation and land dispossession, which results in poor health behaviour and also contributes to the gap seen between non-Indigenous and Indigenous Australians. So the second group I will be discussing is people who have been in contact with identified as a The injection of drugs is a complex phenomenon that is a major cause of morbidity and mortality within Australia. Substance use has a number of issues that are a major concern, those being fatal overdoses, psychiatric disorders, drug-fueled crime, infectious diseases, abscesses, among other health consequences. Within inner city slums, it has been identified that drug exposure is a major risk factor, and a study has concluded within the Australian context that young people who were exposed to other people injecting drugs, this including physical exposure and peer-pressuring as well, were more likely to engage in this behaviour, which has become a rising concern for Australia. People who inject drugs are more susceptible to contracting and transmitting bloodborne viruses, predominantly being HIV and hepatitis B and C. This has mainly been caused due to unsanitary conditions and needle sharing. Due to being situated within inner city slums, access to emergency services remains inadequate, leading to less opportunity to be referred to intervention programs, as well as less access to immediate emergency services, eventuating into increased mortality and morbidity rates. The social impact of injecting drugs is an increased probability of incarceration. Recidivism rates are higher, unemployment, homelessness, as well as associated costs with a range of domains, them being prevention, harm reduction and treatment, healthcare, premature mortality, crime, child maltreatment, work accidents, and productivity. Social determinants are factors that influence one's health outcomes, and people who inject drugs are more vulnerable to a range of determinants that inflict negative behaviours. Within this context, low socio-economical status is the most prominent one. Distinct relationships that correlates between low SES and drug use, which also alludes to homelessness, imprisonment, experience with violence, food insecurity, and lack of education. Ethnicity is also a major determinant that has been very prominent within the Australian context. The Indigenous population are more likely to be involved in injecting behaviours as a result of cultural dispossession, and this has been like an ongoing issue within the Australian community, and also contributes to a major gap that is seen between the health outcomes in comparison to Australian non-Indigenous population. So barriers that affect behaviour change, the main is emotional or mental distress. Users rely on drugs as a form of medication as well as a form of escapism from their realities. Being located with places associated with drugs as well as the people who we surround ourselves with. So if they are active users, they often promote negative behaviours. The final thing I will be discussing today is intervention strategies. So these have been implemented within Australia as well as overseas, and the first one I'll be talking about is syringe and needle exchange programs. Syringe and needle exchange programs were introduced and implemented in Australia in 1986 and has been deemed an effective measure due to low costs and resulting in the prevalence of HIV amongst users remain low and stable. These programs are initiated and supported by the National Drug Strategy, and they also supply sterile injecting equipment, education, information, and referral to treatment, medical care, and social services. So this has been viewed as an effective strategy within Australia as it has resulted in a strenuous pressure taken off the economy and healthcare system, as it has reduced HIV prevalence within the Australian population, and it is easy, accessible, and has very low costs associated with it. So the second strategy I will be talking about is medically supervised injecting centres, and this is a strategy aiming to reduce the health and social harms related to the injection of drugs. A supervised facility that does not promote drugs, however, acknowledges the dangers associated, and in response provides safe environments which incorporates use of sterile equipment and accredited medical professionals. Injecting centres also offer medical assistance and immediate care if necessary, as well as offering pathways to rehabilitation facilities, removing injecting practices from public viewing, provision of safe sterile equipment, access to education and support services, and they have been located in King's Cross in Sydney, as well as north of Richmond, which have both been described as the two most inner city slums in Australia that still remain, as they both have large street-based illicit drug markets in operation. And since opening, they have supported 1.1 million injecting visits and responded to over 10,000 overdoses. Public injecting and increased mortality rates as a result of heroin overdoses became a rising issue, which prompted the implementation of the second medical centre, the first being in Victoria. This is a very controversial intervention strategy due to creating safe environments, however contributing to making law enforcement more complex, and is also being portrayed as promoting and encouraging the use of drugs by society. The final harm reduction strategy I will be discussing is naloxone programs, which are a strategy aiming to reduce overdose and aimed at opioid users that have high prevalence of overdosing. It equips the users or the friends or the family with naloxone, which is a medication which assists in reversing the effects of overdose. It's currently in a trialing process which ends this year. And yeah.